Right? So origin is here on the zygomatic arch, inserts into the ramus of the mandible. This is your primary muscle for chewing, so when you bite down on something, that is your masseter here on the side. Next is the pectoralis major here on the front of the chest. Origin is on the clavicle and sternum, inserts into the humerus, flexion, adduction, and internal rotation. So this type of a motion. So if you really want to develop the pectoralis major, a fly motion is really good. Bench press is not a chest exercise. It's an upper body pressing exercise. It's as much as your chest muscles as it is your shoulders and your triceps brachii muscle. So it's at best an okay developer of the pectoralis major. Next is the rectus abdominis right here. It starts here on the pubic symphysis, inserts into the xiphoid process of the sternum. It's bisected by that linea alba, that line that goes down the middle. Make sure you know the linea alba because you might get quizzed on it. It subdivides it into different sections. So some people have a 4-pack, some have a 6, some have an 8, some have a 10 or a 12. Trapezius. We got two big back muscles. The trapezius is here in the upper back. It's trapezoidal shape. In the bottom, we've got the latissimus dorsi. Trapezius, its origins are on the cervical and thoracic spine. Inserts into the scapula and the occipital condyles. It does elevation, depression, and protraction of the scapula. Latissimus dorsi, down here, its origins are on the sacrum and iliac crest. Inserts into the humerus. Its job is to do extension, adduction, and internal rotation of the humerus. Then you have the sartorius. Okay, sartorius is here on the leg. It's called the gentleman's muscle, longest muscle in the body. Origins on the anterior superior iliac spine, that pointy spot here in the front of your hip. Inserts into the tibia. Its job is to rotate the leg that way, and then also if you want to cross your leg. That's why we call it the gentleman's muscle, because that's the muscle you need to activate in order to measure your inseam to get a suit. Gastrocnemius, here on the back. It's called the gastrocnemius because it looks like two big bellies. Origin is on the medial and lateral condyles of the femur. Inserts into the calcaneal tuberosity via the Achilles tendon. It is one of the two primary plantar flexors. The plantar flexes an extended leg. Quadriceps. We have our 4 quadricep muscles. Vastus medialis, vastus lateralis, vastus intermedius, and then the big one on the front is the rectus femoris. Rectus femoris is a 2-joint muscle. It's involved in flexion of the hip as well as extension of the knee. The other 3 are just knee extensors. Okay. Brachioradialis, that's the one here on the forearm. Origin is here on the humerus. Insertion is on the radial, on the radius. It flexes a pronated forearm. Which way is beach? Which is that way. Okay, that's the brachioradialis. Biceps brachii, right here. Origins are on the glenoid cavity, or supraglenoid tubercle, and the coracoid process of the scapula. Inserts into the radial tuberosity. Flexes a supinated forearm and is a weak flexor of the shoulder. So hands up, right? So you want to get a tip. You're going to use your biceps brachii. Sternocleidomastoid, those are the 2 big muscles here on the side of your neck. Starts on the sternum and the clavicle. Inserts here into this big thing on your skull called the mastoid process. Flexion of 1. Rotate your head. Flexion of both. Flexes your head down. So if you want to look down at your feet, you're going to flex both sternocleidomastoid muscles. And then we talked about the gluteus maximus. Origin is here on the iliac crest and sacrum. Inserts into the gluteal tuberosity. That's that little bump on the back of your femur. It extends, abducts, and externally rotates the hip. So like, for example, in ballet, pirouette, right? Guys ever seen ballet dancers? Male and females, right? They get bounce a quarter off their butts. They got really well developed glute muscles. Gracilis is here on the inside of the thigh. Here. It's an abductor as well as a flexor. And then you got the hamstring group. Lateral one is called the biceps femoris. Then you have the semimembranosus and the semitendinosus. They are extensors of the hip and flexors of the knee. Serratus anterior, that's here on the side, otherwise known as the boxer's muscle. Its job is to protract and retract the scapula. So throw a punch, bring it back, that's the serratus anterior. Deltoid, it's a triangle-shaped muscle. Its origins are here on the scapula and clavicle. Inserts into the tibial tuberosity of the femur, of the humerus. Okay. It does flexion, abduction, extension, and a little bit of external rotation, depending on which fibers you're contracting. Triceps brachii, here on the back. It's got 3 insertions. One is on the infraglenoid tubercle of the scapula, upper third of the arm, lower third of the arm, and it inserts into the olecranon process of the ulna. It extends the forearm and arm. It does both. External oblique, right, so it's here on the side. Its job is to bend the torso, rotate the torso, and also helps compress the abdomen to a small extent. Adductor magnus on the inside of the thigh. Its name should be self-explanatory as to what it does. And then here on the front of the shin is the tibialis anterior. It's the primary dorsiflexor of the foot. It contracts to prevent excessive dorsiflexion when you land on the balls of your feet, like when you're jumping or running. Okay? Those are the muscles.